and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at OnLive. We would like to remind you that the Q&A feature is available, so feel free to send in your questions for our speakers throughout the discussion. And with that, I will turn it over to our moderator, Alex Marsberger, who joins us from SAS.
Welcome, everyone. We're excited for today's conversation, a very member-focused conversation, which is near and dear to my heart. We'll be talking about the mission, I guess if you choose to accept it, of engagement, building tomorrow's member-centric health plan. A few questions that we'll cover. We're going to talk about how to create a more member-centric approach, meeting demand for behavioral health services, leveraging data, both medical and non-data or non-medical for hyper-personalized experiences. I'll be moderating the conversation. And like I said, near and dear to my heart, I held consumer-focused roles at Geisinger Hospital System and on the insurance side, as well as at Blue Cross North Carolina, and now in my role as a global principal at the founder of analytics and founder and future of analytics, SAS. We've got the experts here to do the heavy lifting, and so I'm going to get to their introductions. But first, just a few of the housekeeping items. There is a chat function that you'll see, but there's also a Q&A function. And so we ask you to go to that Q&A section as you wish to ask questions that get answered here by our experts. And so throughout the conversation, if you want to sprinkle those in and say, hey, right, what they just said is really important to me, and this is what I think about it, and I want to do a follow-up. I'll be monitoring the chat on the Q&A side, and we'll get to those questions as well. And then we'll also save a little bit of time at the end to go through some of the most pressing questions that you've got. And so we're excited for this. Like I said, we've got the experts here to do the heavy lifting. First, we've got Kate Duncan, Executive Director, Product Strategy and Management at Healthcare Service Corporation. Welcome, Kate.
Thanks, Alex. Glad to be here. As Alex mentioned, my name is Kate Duncan. I'm an executive director at HCSC. And for those of you who are not familiar with who HCSC is, it is a parent company of 5 individual Blue plans, Blue Cross Blue Shield of Illinois, Texas, New Mexico, Oklahoma, and Montana. I've been with Blue for 11 years now, 10 of which have been in our product strategy and management team, where I've had the opportunity to ideate, develop, and manage market-leading products and services. While I've had the opportunity to work across network products, ancillary solutions, I currently oversee a portfolio of products that we call health management and advocacy. It's basically a fancy term for clinical care management products and high-touch customer service solutions. So things like behavioral health that Alex mentioned, solutions like women's and family health, wellness, as well as our advocacy offerings. And for those of you who aren't familiar with what product does, my role is really on the business side, where really we set the product strategy influenced by things like clinical spend, market trends, and others. We develop internal business cases for either net new products or enhancements to existing solutions. And then once we implement them and they're out in the market, we are the team that manages the performance of those. So ensure that they're doing what they intended to do, whether it's improve outcomes, decrease costs, improve the member experience. So happy to be here. Excited to be a part of this discussion, and I'll pass it over to Nelia.
Thank you. Yep. And thanks, Alex. So my name is Nelia Infante, and I head up consumer engagement strategy and informatics for OnLive Health. I've been here for a few months now. Prior to this, I spent 16 years on the healthcare side in one of the major health plans. And prior to that, I was on the employer side managing health management, health and wellness benefits for many years. So a little over 25 years experience really in the consumer engagement space tied to healthcare. And I'm really excited for the discussion today. So thanks for having me.
We're going straight into the hard-hitting questions. So we've heard about consumer experiences and consumerism in healthcare for a while now. I think it's been sort of that main stage conference circuit discussion for maybe 10 years or more at this point. But in a lot of ways, I think all of our individual experiences with the healthcare system, whether the care delivery side or the insurance system, still don't feel like the consumer experiences that we maybe expect or have come to expect in other industries. Why is it taking so long? Is it just too complicated? And I guess the real question is, should we be changing our expectations on what healthcare experiences can really be? Nellie, we'll start with your thoughts.
Well, I appreciate the hardest question. I think it's like the $1 billion question, isn't it? So I guess right away, I don't think folks should be changing expectations. I think a better consumer experience should be an expectation. I do think we have the ability, though, right now to sort of reimagine the experience. So I might use that term a little bit more. I feel like health plans have been doing a really good job and very focused on the highest cost claimants, right? We think of individuals with chronic conditions and those that are really just using the health system. In my experience, and I did a lot of voice of customer work prior to my current role, those consumers are pretty savvy consumers. They understand the experience. They know what works, what doesn't. And the plans have put a lot of effort behind managing these high cost claimants, truthfully. I think there's a place just below that when we think about the experience though now. So you've got, these two ends, right? Those are really healthy and well, those that are, managing high costs and using the system. But in the middle there, I think there is an experience to kind of reimagine. And they're the individuals that are just starting to use healthcare a bit more. They might be the ones that are just got, their first maintenance medication or just had, an urgent care experience. And I do think there's ways that we should be getting to that population because healthcare is complicated, and that's why the experience is so complicated. That they kind of need help just navigating what is happening there. And I think there is a lot of opportunity to engage that population when we know what those triggers are and how do we leverage those for, just making it a bit easier for them, truthfully. Yeah.
Kate, would love to get your thoughts.
I would agree. I mean, maybe I'm just more a competitive person, but I don't think this is something we should take our foot off the gas. I think certainly it may have come up 10 years ago, but I don't think we haven't been working towards it. It's just a very complex kind of ecosphere that we live in. And I certainly think, the dynamics in the world has changed, right? You think about like technology we use every day, right? Like Apple, Google, Amazon, Uber, I mean, for gosh sakes, Grubhub, like we don't even need to leave our house, right? And so I do think that like the world around us has changed perhaps at a faster clip than us, but I do think that we've made some strides and we're moving in the right direction. You think about 10 years ago, I don't think that we were tracking or reporting or focused as closely on things like CSAT, NPS. Even, more recently, I've been hearing things like loyalty scores, right? When I started, there was no such thing as like a design or UX team in a health insurance world, right? Like, so I do think that we're moving in the direction, but knowing where we want to go and being able to deliver on that are sometimes really different in terms of timing, and especially when it comes to like a highly complex, highly matrixed and highly regulated industry, right? So, I think, but we're all consumers of healthcare, right? Like whether you are a doctor, whether you are in a health payer world, if you're in the pharmacy industry, we're all consumers. I think we all have felt that pain. We all know that it can get and should be better. I think we just all have to work kind of towards that goal together. And candidly, if it takes us too long or we don't do it in a consistent manner, because there's a lot of players in this world, I think regulators step in and kind of step in and force it as well. And so I think don't take our foot off the gas. I think we got to keep going. If anything, we got to like push harder. And I think these are the types of things that kind of motivate us and encourage us to do more.
I want to take a moment to talk about what you just said about sort of what we know versus what we build. and just the timing of that. So I guess the follow-on question is there a particular experience that you and your teams have created that's an example of a consumer experience in healthcare that a consumer would experience in some of those other industries, or that has been an easy one or a particularly meaningful one that you're proud of?
Yeah, great question. So I mentioned in my intro, I oversee some of our advocacy solutions, right? These are kind of the more concierge solutions that we offer to employers, and they buy up for their employees. And our solution is called Health Advocacy Solutions. And it is kind of our highest touch, most concierge solution. It's an integrated clinical and non-clinical, so customer service as well, support for our members, and very proud of that solution. As part of that Health Advocacy Solutions product, you as a member, we call them members, you have access to an assigned advocate. You have one person that stays with you and your family for the life of your healthcare journey. You have access to that team 24/7, 365. And they work on behalf of you. They are your advocate. We're like they're your QB. And so they work with a multidisciplinary set of experts that includes people like social workers, pharmacists, a medical director, a dietitian. And really the intent is to provide you a holistic experience. And with the intent of taking kind of the homework off of your plate, right? Because we all know that we've gone and then you end up leaving a doctor's appointment or leaving your call from a health insurer, and you're like, oh my gosh, now it's even more confusing. I have more things to do. And so, we strive to actually take that off of your plate. We're like, kind of your VIP little team, right? And so that might be something as simple as educating a member on what benefits or resources they have. It could be making an appointment for them, or it could be helping them actually navigate through one of our specialty programs, whether it's through, a condition-based program like diabetes or oncology, or, social programs like gender affirmation or a caregiver support program. And so, that Health Advocacy Solutions team is really your personal guidance and education to navigate them through everything, whether it's medical, behavioral health, pharmacy, social, whatever you need. And so one example within that product is, I still will remember it to this day, is that our social worker had, identified a member who was unfortunately not able to, meet their medical bills. They were falling behind. And so they actually that social worker helped that member understand kind of the broader implications of kind of financial wellness, and actually help them navigate through refinancing their home mortgage so that it positioned them better to be able to stay on top of their day-to-day, bills, like their medical bills. And so, that's an example where it's not the level of support that you would ever expect from a health plan, but it's certainly where or how we need to start supporting our members, because without those types of experiences, it feels very siloed. It feels very like you're on this island all by yourself. And, I think we've seen that it works, right? Not every example is like that, right? I wish that we were, changing lives every day, and every phone call that we had, but we do know that, these types of products matter. We see high savings for employers. We're seeing CSAT scores, over 93%, NPS over 76%, which if you're familiar in healthcare, right? I mean, if you get a 30 to 60 rating in NPS, that's about right. So those are the types of experiences that, we strive to provide to our members day in and day out.
That's going to be the quote, though, is Healthcare Service Corporation is offering affordable mortgages. Or as
be careful. That is not in our jurisdiction. We just help them through, holding their hands and educating them through that process.
What a great story, though, because so much of, like you said, so much of what happens or what drives our health is what happens in our homes or at our homes. And so much of what happens to our health is outside of that traditional healthcare system. And so being able to navigate some of those questions and help, I think it's a great lens to have outside of sort of the traditional blocking and tackling of some of the health plan activities. So I love that example. Nellie, do you have a favorite right now?
So I think probably just adding to what Kate just mentioned, and she said it a little bit earlier too, I do love that plans are starting to incorporate consumer feedback more and more into this product and the solution. Again, you think of what happens outside of our industry, and it's pretty standard to have reviews as an example, as part of any experience. And I think we've kind of underestimated the power of the consumer number and the consumer voice in some of the solutions, in particular when health plans are really being purchased by, typically speaking, an employer sponsored plan. And so at the end of the day, they're the ones that are cutting the check, and it's not the consumer. But the consumer is the one that will typically go to an employer and complain about something that's working or not, right? And Kate, your example, it could be an affordability challenge that the individuals are having, right? And the employers are looking for us to solve for some of that. I think bringing in simple things like what those reviews are, thumbs up, thumbs down, right? They're like a lot of easy attributes you can bring in to just augment a lot of the data we have with what the consumer is telling us as well. So that would be the one I think is probably the one that we are really focused on, as well as how that allows us to personalize that experience right to the end consumer, to really increase the engagement. So, yeah.
Well, you mentioned personalization. I think that's in the same sort of content bucket as consumer experience, where it's been around for a long time. We've heard of personalization. And I always say, I think we got tricked a little bit years ago that personalization was sort of having our name at the top of the email sent to us. Like that was sort of the overall personalization that we would get. Now it seems like we really have that opportunity for a personalization standpoint to find out more about from survey data and the other things that you've mentioned. So health plans have a wealth of member information now. How are they using it to deliver a more personalized experience?
So I'll definitely take that question. And so first of all, personalization, I think, is a very subjective term. Us as consumers ourselves, there's certain aspects that we want to be sharing with a health plan, and other aspects we don't want to be sharing with health plans. And I think that goes to the millions of people using care today. And so understanding that individual, the belly buttons, if you will, out there, I think is an important attribute to add to personalization, because someone might want it just as simple as my name and minimum necessary information. And then I think there's the other spectrum of how much information can I give you so you can make it so much easier for me and help me navigate this complex healthcare system. I think, when I'm starting to think more and more about things like the pandemic, for example, and how we could leverage data, we've got hear things like the Great Resignation, but then you hear about just people having access to be more mobile, right? They're working from home. They have the ability, maybe to move from, an urban environment to a suburban environment. There's just been a lot of movement. And one of the things that I feel like we could be leveraging more to the consumer's advantage and the plan's advantage, truthfully, is how do we take that kind of movement and maybe provide some care navigation, right? So if someone's moving somewhere, we know that, right? We have that information. It's one of the things they have to update. How do we use data in a different way that says, okay, maybe plans want to ensure that the patient or the member is getting to high performing providers, right? A value-based system, what have you. When they're moving, they likely have to go and look for new providers. And so that in of itself can be extremely stressful for folks, but it's a simple piece of information we have that we could be leveraging in a different way to do more outbound. And outbound doesn't have to be somebody on a phone. It could be digital interaction, but leveraging that, building that as one of the important triggers. And then you can go further. So like Kate was mentioning with her health advocacy products, right? We can then maybe transfer clinical files, right? Your health history information from one place to another, help you schedule appointment, help you find, specific specialists in an area if those are the things that worry you. It, starts to build credibility, trust, loyalty, as she mentioned. I think there's a lot of opportunities. And that's like a very simple data point. I think we tend to go to all the really complex things instead of, some things that might be right under our nose that help us solve some of our bigger objectives as plans and getting people engaged. Yeah.
Yeah, Millie, I love that example with the address. That is like a simple one, right? And also one of the most like stressful times in your life, right? When you're moving. So I think that's a great example. I think, Alex, per your original question, right? Like, I think you mentioned the like health plans, and we all have so much data and almost like too much that we don't know what to do with it, right? And so like, I'm a firm believer that like there's a difference between having data and then being able to organize that data and make sense of it to actually drive insights, and then take those insights to actually leverage them into actionable change, right? There is a very different kind of philosophy and skill set and process that involves in each one of those steps. And I think it can differ, and it can go faster, slower, depending on how much volume of data you have and the complexity of data, right? And so I think, unfortunately, in the health world that we live in, you have a high degree of both. But I do think we know it's possible, right? Like, there are integrated customer data platforms that allow, business users access to member profiles, personas, product offerings that they have, interaction history, health status, like Nelia said, and even, social determinants of health information, right? All to be able to connect members with the right services that they need when they need them in the channel of their choice. And so, we've had systems to track member communication preferences, whether, do you want to hear from us from email or SMS text or mail? We've had that for years, but I think, a lot of what we've been trying to do more recently is, figure out how to be more proactive and personalize those engagements with us. And so, our data science team has been modeling something that we're calling like a member segmentation model, right? Trying to understand, various groups, health risks, demographics, attributes, and how they feel about healthcare, right? Because that can really change the way in which we engage with them, the message type, like to Nelia's point, right? Maybe someone's totally fine, just like, they only need one reminder, a short reminder, and then they go off and do it. Other people need a little bit of nudging, right? Other people want a lot of data. Others just want like a picture with a few words, right? We have the ability to be able to do that, but it does take some like complex data kind of science behind it. And so one of the examples that we saw work was, within our social determinants of health, where we have an identification model, right? We use the CDC's social vulnerability index, identifying members, right? We're outreaching to them for our social workers. But we've recently now added a layer of, well, not just who might need us, but who's actually predicting the likeliness of engaging with us, right? Because some people just don't want to talk to us. And so we've seen, since adding that kind of layer, we've seen those engagements with our social workers more than double. And so that, I think, is a great use of data where we're not bothering people who don't want to be bothered, right? We're actually making more of an impact for the people that need it the most. So I think there's a lot we can do with data, but you do have to kind of go through that process of like data synthesis and then, really trying to figure out what your action is.
So we talked about personalization and love those stories. We're going to make this a very personalized experience for the viewer and listener right now, as we've got a bunch of comments and questions. So one comment, just from a feedback standpoint, they said, thank you for pointing out, what does personalization really mean? It has become to them almost that white noise. Many companies don't know what the term actually means. Forcing people to enter their name and zip code to get information for what should be publicly available does not equal personalization. And so I think that point really resonated here in the questions and in the chat. And then Kate, you mentioned workforce, this advocacy group, with that VIP sort of concierge team. There was a question that came in specific to that of how do you maintain continuity of those people or teams with all the workforce retention issues? So if they're engaged in your life and actively know you, how do you sort of maintain that?
Yeah, it's a great question. I mean, we certainly have the systems behind the scenes that will track, you know, when you became a member, and how long you've been a member, and your history and all the solutions that we have, so that our advocates can deliver like the best experience for you. Certainly retention has been something that is front and center, right? With a lot of layoffs and changing jobs. And so that is a dynamic experience that we need to be able to manage. That, you know, not everyone starts in their job on 1/1 when your health insurance benefits start. So it is something that we have to, you know, manage to as a new member rolls on, as a member rolls off. And so, but fortunately we have kind of the tools and technology to be able to manage through that.
Now we're getting a flurry of questions around behavioral health, which is one of the stated goals of the conversation, was the whole behavioral health topic. And so obviously the need for behavioral health services has exploded the last few years. And maybe it's not overall the need, maybe it's the articulation. The need may have been there, and now we're just talking about it more and focusing on it. What are you seeing as sort of either the biggest areas of need, or how health payers are evolving their behavioral health programs?
Yeah, that's a great question. I think it's a topic that needs to be front and center, like in every single platform and forum that we talk about, because it is, it truly is. I remember when we were talking about COVID, and I was like, guys, COVID is one thing. I'm like, BH is the tsunami that is coming after this, right? And I do think we've seen that. Pre-COVID, right? 1 in 5 Americans had a mental health disorder. Since then, it's closer to 40% of adults have reported symptoms of anxiety and or depression. 1 in 2 reporting anxiety, depression, 1 in 3 having trouble sleeping, 1 in 3 having worse chronic conditions due to stress. I mean, it goes on and on and on. And so I think it's an important topic. So thank you for bringing it up. I'd say, while it's fair to say that like across the board, we're kind of struggling for, how do we keep members healthy, happy, well? BH is certainly a focus area that we need to shed a light on. A couple areas I think of interest and focus that we've seen is, of course, access to care. I mean, I think it's fair to say, like in many areas that we don't have enough providers, but this is one that we truly don't. We don't have enough providers, especially prescribing behavioral health providers. And, I kind of think about, I have a sister that's a teacher and a principal. Like, I kind of see that role of a behavioral health clinician and a teacher very similarly. We've done nothing but put more on their shoulders. And so we're not helping the situation in terms of the future, right? I mean, these individuals are looking at it and saying, do I really want to go into this field? Like, this is a lot that I'm carrying with me. So access to care is a big one, whether it's in person or more recently, right? Telehealth has really helped kind of open up the access across the country, which is a really, really good, helpful thing. But not everyone is, it's not always a good fit on telehealth. So please, figure that out. The other piece too is, I think people are more aware of the need to treat behavioral health alongside other comorbidities. So you really can't separate out your physical health from your mental health, right? Like you can't do that. Things like, women's and family health, right? A lot of emotions changing there. You just got an oncology diagnosis. That's super stressful. You're a caregiver, right? Like the list goes on and on and on. And so like I think we've seen more of a focus on, trying to really care, talk about and support members with BH next to all of those things, because we really do need to do that more. The other aspects I'd say were, we've seen some spikes in kind of the mental health world, right? Substance use disorder, huge problem right now. We oversee like a substance use disorder program. And if you remember on January 6th, the whole like storming of the Capitol, we saw a 600% increase in substance use for our population that's managing their substance use disorders. And so, that's a big one. Eating disorders is a big one. And pediatric support's a big one too. We're seeing a lot of our kiddos are having trouble. So that's been a lot of focus. And then finally, I think the need to destigmatize kind of mental health overall. I think the fact that we don't think twice about having an annual physical every year, but we don't think about that in our mind in the same way. So we do need to make sure that this is a common place, that everyone, goes through this, and it's not bad or it's not wrong if you need to get a little help. And so I think those are kind of some of the themes that I've seen in terms of trying to attack this behavioral health problem that we're going through.
Thank you so much. Nellie, on the stigma side, I think especially, you talked about that stigma that's unfortunately still often associated with behavioral health and mental health and well-being. Are there best practices around sort of what we've learned communicating with members in a sensitive topic? And Nellie, do you think health plans play a role in reducing the stigma still associated with mental health?
So I'm definitely no behavioral expert. I worked in behavioral health and spent, at least 2 decades in the space, but, there are people who really understand the space way more than I do. That said, it's taken a lot to happen in our society, I think, to start to destigmatize behavioral health, being completely candid. I don't think it's like a health plan solution only. In some previous work that I did, just even understanding on the provider side. So, most individuals focus on, whether it's talk therapy, right, psychology, psychiatry, et cetera. But, most individuals aren't just going straight to a psychiatrist, right? They're starting with probably a trusted provider partner, a primary care physician at first. It could be your OBGYN, starting with, maybe it's postpartum depression or something. There's a lot of different entry points. And one of the biggest challenges that I had seen is providers don't actually feel prepared to manage the onslaught of, just the variety of behavioral health issues, what to look for, and then quite frankly, where they can get access to care pretty quickly for their patients. So I think it's kind of one of these ecosystems that we really need to look at all different parties from a stigma perspective for sure. And then I do think, to Kate, what you said, if there is a stigma, I think having access to virtual health has probably of everything that happened during COVID in particular, I think this has been one of the biggest benefits to individuals, is being able to at least begin, getting care in the comfort of their own home for something that still has, a lot of stigma associated with it. And then, from a provider perspective, just even being able to communicate some of that to their own patients, so the patient has somewhere to go and somewhere to start. And then I know plans are really augmenting virtual care now to say, okay, how do we bring virtual care and, brick and mortar or in person together? So I think a lot of those things are starting to just open up, some of the stigma issues, but it also is important that access is really there for individuals. And I think we have a lot of work still to do there to kind of connect those dots, truthfully.
Yeah, I would agree. We did do a pretty in-depth primary and secondary research on how to talk to members about behavioral health, because it's a sensitive topic, right? And we don't want to make it worse, right? And so we were very mindful of what are the right words to use? How do we position this? And so some of the things we learned, and it was fascinating, but words matter. Use the words that you would normally speak. So we had this big, don't use use therapist, not clinician, right? Like clinician's like a health plan word, right? Like use mental health, not behavioral health, right? Also like minimize the negative language, right? Like we don't want to call it a mental health issue, right? Like, so we try to like not use those words. We try to normalize mental health so that it's clear that this is normal, this is common. I mean, you heard the stats, like it is common, like that's not just like words we're saying, like it is. And then of course, like empathize, right? You want to empathize with the struggles and complexity of what they're living with, but also like focus on the potential for positive outcomes, right? And then like finally, it's just making sure they know that they're not alone. And so that's really how we've tried to position it, as that like, we are here for you. We can help you through this. Like you're not alone, right? So though we have seen some really improvements in terms of member engagement as we've kind of shifted the way that we talk about this. And I think we're still learning, right? But those have been some of the more helpful kind of lessons learned that we've at least experienced on our side.
That is really helpful, Nellie. I think I really appreciate how you talked about the sort of ecosystem, and I'm sure Kate appreciates how you didn't pin it all on health plan solutions. Mm-hmm. This isn't a singular issue. And so I think there's definitely an ecosystem challenge and a societal sort of reduction of stigma as well. And then Kate, I love how you talked about the language matters. I think we've seen that in social determinants of health, is when we address it as homeless people versus members experiencing homelessness, it changes the dynamic of the conversation. It changes the solutions that we're able to offer. And so I really appreciate the thoughtfulness that went into studying it and understanding and listening, and then responding to that through words, because like you said, words definitely matter. I'm going back to the Q&A side because I see it lighting up over here, and I'm going with 3 questions is a trend. And so there were actually 3 specific questions about transportation. One, I think all directed at you, Kate. The first one was, is medical transportation included in your product mix? And so I think that was back on the intro side of here's all the stuff that's under my purview on the product side. So is medical transportation included in your product mix? Another one into transportation. And then the last one is, this question is for Kate. We know that transportation is a major social determinant of health. Our team is wondering, when you're designing the experience with your products, how you think about transportation, where does it fit in? And I think these were all in the context of that advocacy group and the product mix. And if someone calls in virtually and needs a ride, if you can only solve their problem virtually, what does that do?
Yeah, absolutely. So I will say, just like anything, oftentimes your benefit and services are dependent upon whatever like your employer selected and offering to you. However, the short answer is yes. Whether that be baked in as a like quote unquote benefit in a product, or we have just social communal resources that you as a member can leverage. Yes. So I think it was like a number of years ago, and I can't remember, it was like when Lyft was like super early on in their like life. We actually had like a partnership with them to be able to give like discounts to members. But that's a lot of what our social workers do actually, is that they support members who you need to get to the doctor, but you can't, like, we can help you with that. And so if you ever have a question around those types of things, don't hesitate to call into your health insurer. Like you may not realize the services that are actually available to you that you may not be taking advantage of. So the short answer is yes. And please do call in and learn more, because that's what those things are for, right? We want you to get to the doctor. We want you to be able to get where you need to be.
There's significant challenges on the payer side, and so on the financing of healthcare and the expense and sort of care navigation type pathways. There's also significant trends on the delivery side, especially on the sickness side. So we have an aging population. From some of those statistics on the mental and physical well-being, both sides of that, increasingly sicker population. You add in what we know about physician and nursing and workforce shortages, and we have that real accessibility and availability crisis. What role and how can health plans improve the ease of access to the healthcare system? If it can't be all done virtually, is there a place that more payers are going to become providers? Is there more investment in providers? Can you speak a little bit to that, the access side?
Kate, do you want to take a stab at it first?
Sure. I mean, that is a very loaded question there, Alex, but I'll see if I can chip away at that. And then Nelia, please feel free to fill in where you see fit. I'd say yes, absolutely. Access is an issue. I think we just talked about it with BH, but it runs rampant across the board. I think, every health plan, I think, is working to expand access to, in-network providers and vendors and where appropriate, right? Like, especially on the product side, like we want to invest in deeper integration with the goal of kind of making a seamless experience for our members, right? So I always kind of call this the 1+1 should always equal 3 or more. Because if you're using our products and solutions together, like they should work better together than if you like went and, bought something or have something outside of us. So access to care, kind of the contracting piece, the integration for that experience in select cases, critical. I think the other piece is like, you could have the biggest network, which oftentimes Blue does, but like, you still don't know where to go, right? And so I think we need to work on kind of our transparency solutions. We've had, at least HCSC has had, a provider finder and a cost estimator for like over a decade now, like well before the Transparency and Coverage Acts required it, right? But I think that, it's one thing to be able to say, here is a list of providers that are based on cost and quality, but you need to be able to make it easy for them to understand. We need to be giving additional data points that, members can filter on, right? Like things like, LGBTQ friendly providers is a big thing, right, wrong, or different. A lot of people want to go to providers that look like them. And so being able to provide some of those additional data points, I think is really important. And then, take it one step further. How do we enable easy self-service solutions like online scheduling directly from like our portal to the providers, right? Like I always think of it as like open table for providers, like, let's make this easier, right? It shouldn't have to be this hard. So that's, I think, kind of on the transparency kind of side of it. And then I think the other piece is like, let's be honest, like people don't care about healthcare until they need it, right? Like, so, and at that point, it might actually be too late, or it might, we're already have the NPS stacked against us because like people are frustrated, right? And so, I think another big thing that we need to be working on, and I think we're making strides in, is how do we proactively identify and engage members before they even need it? And so, I think for a long time, people were like, ooh, that's a creepy factor. But like, I think like, to the beginning of the conversation, right? I think that's kind of starting to be the expectation, right? Of the Netflix, Amazon world, right? So I think we've seen some good results in like recent pilots where we've actually predicted members who may need a shoppable procedure. And when I say shoppable, I mean like you could actually go to a different provider or facility for lower cost. And so we've actually identified members that we predict will need a shoppable procedure, and then actually proactively outreach to them and help them find, high quality, cost-effective providers so that they're prepared if or when they need it. And so that I think is a good opportunity. And then the final thing I'll say is around, like, I'm a big behavioral economics person. Like I went to college for like organizational leadership, which I don't think that even exists anymore, but like, I think the new name would be like behavioral economics, like what makes people tick, right? And so I think we don't use that enough in our industry. And I think there's an opportunity to leverage a lot of those behavioral economics to drive change and actually have members take some sort of action. Sometimes you just need a little bit of a nudge to start that domino effect. And so like, I'll give you an example. We'll loop it back to OnLife, right? Like our wellness partner who's sponsoring this. We see that on average, we have a 50% higher engagement for activities that earn a reward than those that don't, right? Pretty simple, right? I'm gonna earn something if I do this. One of the activities being a health assessment, right? Like we want to know, like, how are you? Where are these areas that we need to work on? And so, 63% of those members who take the Well on Target Wellness portal, like who register, actually take a health assessment. And then 60% of members who engage with our wellness portal identify at least one health issue. And so, and then of those individuals, 30% of those are actually engaged in a self-management program. So you see that like the numbers don't lie, right? As soon as you can kind of get someone hooked, like we can help them like navigate, get involved in more things. But sometimes we just don't use kind of that behavioral economics enough to our advantage. So I think there's some untapped opportunity there as well.
And then I'm going to
fill in the gaps.
Yeah. So, hey, I'm so glad I let you take the question first. Kate, you did an excellent job there. I wanted to just augment that a little bit with a couple of ads, right? So really just piling on the last couple of comments, because I do think, so you asked a question earlier, Alex, about data and how we're leveraging data. And I think this is like, you kind of bring these two questions together. I do see that sometimes we have to learn how to be in the right place at the right time. And I don't think we're really great at that yet. Right. So you kind of think of a population, right? Most people are making a key decision on benefits once a year. It's usually something that's taking no more than 15 minutes of, lifetime, right? They're going to go, and some people are just going to be cost conscious. They're going to go to the most, cost effective plan, benefit plan to them. Other people know that they're going to really use stuff, right? So you've got a lot of that stuff. But in many instances, those, I kind of made this comment before, those that are really consuming care all the time, they've got this, they know what they need to be doing. But when you kind of go down this other level, and the person that is making the decision in 15 minutes or less, they're probably not using healthcare much today. But there's going to be a day where they need it, whether there is a life event or some health condition that comes up, right? Whatever that might be. And it's not intuitive for most people to say, let me go see what the plan has for me. And I think we need to start doing a much better job of understanding that, whether it is behavioral economics or, finding ways to collect certain pieces of information that help us, right? So the health assessment's a perfect example, Kate, where oftentimes in many health assessments, and I think they all have opportunity, it's how do we understand what's to come? And then how are we leveraging that data and information to be, forward thinking, predicting what this member may be doing next? And I think there's a lot of opportunity to not just collect the data, as Kate, you mentioned before, right? We've got to get to what does the insight tell us? And then more importantly, what do we actually want to do with this insight? Some of it is things we would put back out there, and then other things are things we want to confirm with the member, and then they might not be ready today. And so there may be a new piece of information that then tells us, wait, maybe they're going to be ready tomorrow, right? So, classic example, almost every plan wants everyone to have an annual physical, have a primary care physician, right? Seems like a really simple thing that we should be able to solve. We still haven't solved. I can't even quote the percentages. It depends on the plan, right? But the reality is, again, I don't want to say every millennial, but a lot of them don't necessarily feel the need to have a primary care physician. They had a pediatrician, they went off to college, whatever it is, they might be on mom and dad's plan, but like, you already know they're going to hit 25, which means they're going to be 26 soon. That's a really good piece of data that tells us what we could possibly be doing with them next, right? And then we've got to find out if they're ready for that. And then from there, if they're not, what do we do, right? So when you think about engagement and experience and how these things work together, I might not want you to do anything with that today, but as a plan, we might say, look, you're not ready for me today, but we have this directory. I'm going to send you some information in the area that you're in right now. And when you're ready to make the decision, come back to us, right? And there's different ways and forms to do that. So I just think there's a lot for us to be still doing with new data and information that really drives a very different engaged consumer in healthcare that's less traditional, right? Like reducing ER visits, managing a chronic condition. Yeah.
And Nellie, I think your comment is so true. And it's a little bit of a dagger in my heart, right? Because like product feels that like we need to give all these solutions to members, right? And we work tirelessly to deliver this new thing, right? And at the end of the day, right, I think, Alex, you're kind of like going around this whole topic is like, does the consumer actually think that that's something that should be delivered by the health insurer? Do they trust us? They surely trust their provider more than us, right? Because like we're just this person that or entity that like denies claims and sends them an EOB. That's not what we want to be, right? We're so much more. But like to your point, like there is this like, well, a lot of times people don't know what is even available to them or where to go, how to navigate it. Healthcare is super complex. And it's funny, you said 15 minutes to pick a plan. I've worked in this industry for a very long time. And I will tell you, I spend so much time trying to pick my plan. And I still, even though I know the products, I still go back and forth on which one I should do. So it's a very complex world we live in. Just when you think you know it, you know, there's a lot to it. So I think it's a big doozy of a question, Alec.
Right. Well, one of the things we promised was to help listeners and viewers here today sort of understand that member focused mindset and how do you build that member focused plan. And it sounds like, to be honest, and I see a bunch of these, not only questions coming in the chats, but just the sort of recognition that this is spot on. There was just one that came through saying, in quotes, people don't care about healthcare until they need it. This is key to so many organizations. I think so many of the things you've said have really resonated because, and it sounds like the real key to creating that member focused organization is to have people like you, Kate and Nellie. You've been so thoughtful in the approach of, I loved hearing the examples, Nellie, that you talked very specific, like here's timeframes in people's lives, whether you're aging off of a parent's plan. I think Kate, you mentioned moving. And so you have to update your address anyway. And so you've talked about sort of, here's these milestones, here's these timing parts that we know are going to happen. Let's really listen to the customers. You talked about reward system, like let's find out what's important to people and then figure out how to incentivize them to do it. And we've seen the numbers that you backed it up with. So I just love the thoughtful approach that both of you have taken. I think that really resonates of, at the end of the day, and you even referred to the Healthcare Service Corporation as a person, which I think at the end of the day, organizations are largely reflect the people in them. And so I think a major takeaway that it seems is confirmed in the questions and comments in the chat is building a member-centric plan takes member-centric people, and you have to really care about people and care about their individual wants and needs. One of the comments that's come in here, and I think it's been touched on, is that the title was about member-centricity. And so you're from like a health plan membership, but I think we've all used the words patients. And so you sort of cycle between patients when they're maybe in the hospital or on the hospital side or getting care delivered. And then we talk about members, and then we've also used consumers. Is there a reflection that you have on an industry standard word? Should we just be referring to everyone as consumers now? Should we be referring to them as members when they're members of the plan? Do you have thoughts on that?
They're members to us. So we feel so fortunate to be able to serve our members that's how we view them. I'll go months with not hearing the word patient. So members truly how we view all of you. And if we are so lucky to serve you in our states, consumer is an easy one because I think it's also just we are a user of healthcare, but yeah, my vote is always member.
Yeah, and I definitely stay away from patient just because I think patient at the end of the day is very focused on someone that's like within, you know, some healthcare situation at the moment. So I don't think that's reflective of sort of the whole journey, the whole experience. I tend to go down the consumer route just as someone that's done a lot of customer experience work. And, you know, at the end, we are all consumers of care across that spectrum. And I think it's probably the term that just overall reflects the whole population and where you are in that continuum of care, right? So, but I think almost every plan uses member as in, you know, again, who's purchased care from you is usually a membership of some sort. Yeah.
So we only have a couple minutes left, and we're going to squeeze every bit of expertise that we can to get the money's worth from the viewership standpoint.
Paid, to be clear.
One question came in, and we're gonna put you both on the spot for like a minute response to this very difficult question. Health plans are among the least trusted entities in healthcare. Is it possible? And I think we've talked about that trust throughout the webinar today. Is it possible for health plans to regain trust with members? And what might this require? So we'll go rapid fire. Major trust issues in healthcare. How are we going to solve it, Kate?
I mean, yeah, I hope. That's why I have my job, right? Every day I come to work hoping that I can make some improvements and impact people's lives, even if it's just one person. So yeah, I wouldn't be here doing what I'm doing if I didn't believe we could, and I didn't believe we should. So absolutely, yes.
And I would add that if you ever looked at, trust or loyalty scores for those that actually consume care versus those that have a benefit, but they're not leveraging it, the scores are vastly different. So I do think, we've kind of been talking about this through most of the webinar, and it really is an age-old problem in healthcare. Folks generally just use it when they need it. It's an insurance at the end of the day, but there's so much more out there to offer, right? OnLife, the company I work for, we offer a lot of health and wellness, right? That is not necessarily when you're sick, but we've got to find better ways, I think, as an industry to get folks consuming care before they actually need to use like big healthcare insurance types of things. And I think that's going to change the paradigm around trust and loyalty, truthfully.
I think the gavel or whatever the mic drop at the end of really appreciate the takes. And Kate and Nellie, we're coming up on time here. So appreciative for all the infinite opportunities for you to spend your time in the world that you spend a little bit of time here today. It looks like from the comments and the questions, really well received, and so appreciative of your time and expertise and all of the ways that you're building a healthier future through the health plan services and products you've built and continue to build today. So thank you.
Thank you. My pleasure. It's been great.
So it was wonderful. To all the viewers and listeners, we are so appreciative. Again, there's infinite demands on your time to spend an hour with us today and to be so engaged in the question and answer and things. We'll be following up. I think we've got some names and thoughts in the chat here as you've answered questions. If we didn't get to them, I think there's ways that we can follow up through the system. So appreciative of you joining us and being part of this important both discussion and the actions around creating member-centric health plans. Have an incredible rest of the day.
Thank you to Alex and all of our speakers. Please visit our website at hlth.com to catch up on all Health Go Live webinars. And join us in Las Vegas, November 13th through 16th for Health 2022.